Now, injections are a common intervention for arthritic joint pain. So in today's video, I'm going to tell you what they are, how they work, and make sure you stay tuned until the very end where we'll go through how effective they really are. And I'm going to start right now. In today's video, I'm going to focus mainly on corticosteroid injections, also known as steroid injections, just because they are by far the most common type of injection that you will get offered if you have arthritic joint pain. If you are being seen in a private healthcare setting, you may also get offered a hyaluronic acid or a PRP injection. Now, as it stands in the UK in 2021, evidence-based practitioners have to try and adhere to the NICE guidelines. They are the National Institute of Clinical Excellence, and at present they do not support the use of hyaluronic acid injections for arthritic joint pain. Now, steroid injections are man-made and they normally include some steroid, but also some local anesthetic. And the idea is they're supposed to try and dampen down the immune activity in the affected joint and also try and decrease the amount of inflammation in the joint. Injections for arthritic joint pain are always intra-articular. Now, this means the steroid is injected directly into the joint capsule as opposed to the surrounding soft tissues. Now, this is normally done in either one of two ways. Now, the first option would be the injecting clinician will use the bony landmarks around your joint to locate the exact position that the needle needs to be inserted into. Or you could also have an ultrasound guided injection whereby the clinician will use an ultrasound scanner to locate the position that the steroid needs to be administered. The most common sites of injection for arthritic joint pain would be knees, hips and shoulders, but you can also have steroid injections into elbows, wrists and ankles, even your spine and some of the smaller joints as well, including your fingers and toes. And the idea is that they're supposed to try and help with swelling, redness and pain in the affected joint. Now, with any invasive treatments, there are potential side effects associated with them, albeit with an injection, they are quite low. But there is a chance that you may have an increase in your pain, potentially some bruising and swelling for a few days. You may notice that your face becomes quite flushed, and you also need to make sure that you're looking out for signs of infection. In addition, the steroid in the injection can have an effect on the fatty tissue around the injection site, and this can make the skin look slightly dimpled permanently and maybe slightly paler in colour. If you have diabetes, you may notice that your blood sugars are raised for a few days, and if you have high blood pressure, you may notice that your blood pressure is raised for a few days. Now, there are a very small number of people that cannot have a steroid injection, and these include individuals that have local cellulitis around the affected joint, septic arthritis, bacteremia, those that have an acute fracture, and obviously you wouldn't have an injection into a joint replacement. Apologies, I'm interrupting just for a second to say if you are enjoying this video and you would like to know more about osteoarthritis and all other things of pain and rehabilitation, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you very much for watching and enjoy the rest of this one. There are also a very small group of people that we just have to be very careful about giving a steroid injection to. And these include individuals on blood thinning tablets or who have a blood thinning condition, those that have had or got osteoporosis or cancer in or around the affected joint, those who have uncontrolled diabetes, and those who have had multiple injections in the past with limited pain relief. So when is an injection appropriate? Well, with any invasive treatment interventions like an injection or surgery, they should never really be first port of call in your treatment pathway. We know that the evidence suggests that the best treatment options for arthritis are exercise and weight loss. Now, I have done a video on the best and worst treatment options for osteoarthritis, and you can find that here and in the description below. We also know that you can only have a certain amount of injections in any given time frame. So with this in mind, there are a few categories of individuals that could benefit from a steroid injection. Now, the first category are those that are just not that interested in engaging with rehabilitation or weight loss and lifestyle changes and really want an injection. And that is absolutely fine. The second group of people are probably the people that I see most. And these are the people that have tried a conservative treatment program. So they've done the exercise, maybe some lifestyle changes, heat, ice, pain relief if needed, and they either haven't seen any reduction in their symptoms or they have seen some reduction in their symptoms, but they haven't reached a level of function or pain reduction that they're satisfied with. Now, I did say at the beginning of the video, if you did stay tuned until the end, I'll tell you exactly whether injections work or not. Now, unfortunately, there is no black and white answer. There is no way of knowing before you have the injection whether the injection is going to work at all and or how long the benefits are likely to last for. If you are watching this video, there is a chance you have arthritis or you know somebody that does, in conjunction with the fact you may have had an injection or know somebody that has. Now, I promise you there will be a very varying perception of how beneficial injections are. At one end of the spectrum, you may have found that they were amazing and they gave you a lot of relief very quickly for a prolonged period of time. However, at the other end of the spectrum, you may have found that they gave you no relief at all. And this is further confirmed by the evidence, which suggests that unfortunately, injections don't always work for everybody, but in some cases, the benefits of the injection can last up to a year. It's always advised that if possible, an injection is used in conjunction with a specific tailored rehabilitation program for you. As with any intervention for any other condition, it's all about having as much accurate information as possible so that you can make an informed decision about your treatment and your condition. Thank you very much for watching. I hope you've enjoyed today's video. There are some useful links in the description below the video to help you manage your arthritis better at home. And I'd love to hear from you. So drop me a comment below the video and let me know if you've had an injection and whether you felt it was helpful or not. If you are new to the channel, then do hit that subscribe button so you get notified every time I release a new video, which I do every single week. And if you're feeling very generous, then hit the like button whilst you're there. If you have enjoyed this video, then you may also like the video that I have done on how and why exercise works for osteoarthritis. And there is a whole playlist on the channel to help you manage your arthritis better at home. Thanks again for watching, and until next time, I will see you again very soon.